Alex sent us a question about fine-tuning treatment for UARS. The concern, of course, in any patient of this sort is when you are getting your titrations or you're using particular devices, how do you know whether the UARS component is actually being resolved? So this is a very tricky and sometimes very difficult process. If you go to sleep centers that routinely work with the system of monitoring what are called flow limitations or RERAs. RERA stands for respiratory effort related arousals. Same thing. All of these things mean upper airway resistance. If you go to that kind of sleep center where their lab is looking at this and trying to normalize the airflow curve, then you're likely to be in good hands, because at any titration that you go to, they're going to be able to eliminate, hopefully, all of the upper airway resistance, leaving only normal breathing. Now, the next part of this, though, is what about the individuals who get specific devices? Devices that give you data downloads. Well, the majority, if not all of the data download devices at this point in time, as I understand it, are not looking carefully at the UARS, and you tend to get data that says, well, what's the apnea-hypopnea index doing? Not what is the UARS index doing. There used to be an old machine with ResMed's AutoSet that looked at this. It was called the flattening index. There may be other devices out there now that are using things like a flattening index, which is a measure, of course, of the inspiratory curve flattening, which is the sign of upper airway resistance. So if you're having to rely on a device, let's say you were given an auto CPAP or an auto bilevel device, and you're trying to look at the downloads, it's very difficult to be able to make clear sense as to whether or not you're getting a good response. So that leaves us with what is the poor man's solution in this case, and the answer is pretty much going by your outcomes. If you have residual daytime fatigue and sleepiness that you think is beyond what a normal level should be, then that should trigger you to the thinking that you probably are not your machine is not being as aggressive on the treatment of the UARS as you would hope. And that may require you having to go back to the lab for another titration. But then that brings you back to the very beginning. You've got to make sure that lab is going to be aggressive in treating out the UARS events, and then you can see with these new pressures, which might be slightly higher, whether or not you are getting the better outcomes that you want. That is, less daytime fatigue and sleepiness.